Welcome to our channel, where we explore topics related to mental health and wellness. Today we're discussing a very important topic, Obsessive-Compulsive Disorder, or OCD in children. As a parent, it can be challenging to recognize the signs and symptoms of OCD, but with the right information and support, you can help your child manage their symptoms and thrive. I want to share this with you because I am an OCD mom, and I remember at the time my child was struggling, I was feeling overwhelmed, confused, and I really didn't know how to best support my child. OCD is a mental health condition characterized by recurring intrusive thoughts known as obsessions and repetitive behaviors known as compulsions. These obsessions and compulsions can significantly interfere with a child's daily life, causing distress and impairment. Here are some subtle signs and common obsessions associated with OCD in children. Excessive questioning, repeatedly asking for reassurance about things such as safety, health, or routines. My son asked me constantly to check his temperature and if he looked sick to me, or he'd ask about when I bought the milk, for example. Displaying an excessive need for order, symmetry, or precision in their work or play can be another sign. Rituals engaging in repetitive behaviors such as tapping, counting, or repeating certain words or phrases. Avoidance behaviors, avoiding certain situations, activities, or objects due to fear or anxiety. My son started to complain about feeling sick in order to avoid going to school. I also remember at the time he would only wear blue underwear, but he was 9 years old back then, and at the time I didn't think much about it. Physical complaints, experiencing frequent headaches or stomach aches or other somatic complaints. My son always had a stomach ache. Common obsessions, fear of germs or contamination, excessive worry about getting sick or contaminated by germs, leading to excessive hand washing or cleaning. I only discovered later on that my son's fear of germs stemmed from his fear of vomiting. If he became sick, he was deathly afraid of vomiting. Reoccurring thoughts about potential harm or danger to themselves or others, leading to excessive checking or safety behaviors. My son worried about his dad getting into a car wreck while traveling for work. Symmetry and order, a strong need for symmetry, order, or precision in their environment, which leads to repetitive behaviors like arranging objects in a certain way. Intrusive thoughts, recurring unwanted thoughts about taboo or disturbing topics such as violence, sex, or death. Excessive worry about making mistakes or not doing things perfectly, which can lead to repetitive checking or reassurance seeking. Preoccupation with body or health, so excessive worry about their body or their health, which leads to repetitive behaviors like checking for illnesses or injuries, checking for temperatures. Do I look sick? Was a question I got 1,000 times a day. This led him going to the school nurse, asking to have his temperature checked, or if he looked sick to her. Fear of losing control, recurring thoughts about losing control or going crazy, leading to excessive safety behaviors or avoidance. Common compulsions that occur in order for them to reduce their anxiety include excessive hand washing or cleaning, repeatedly checking things such as locks, appliances, or even homework, counting or repeating, arranging objects in a specific way or following a strict routine or order, seeking reassurance. Keep in mind that these signs, obsessions, and compulsions can vary in severity and may not always be obvious. What can parents do about the assurances? When a child with OCD seeks reassurance, it's essential for parents to respond in a way that supports their child's recovery. Here are some tips. Avoid providing excessive reassurance. Limit reassurance, so avoid providing repeated reassurances, as this can reinforce the child's OCD symptoms, and it does. Don't answer repetitive questions. If your child is asking the same question repeatedly, try not to answer it. Easier said than done. Encourage them to use their own coping skills. Avoid giving in to demands. Refrain from giving in to your child's demands for reassurances, as this can create a pattern of reinforcement. This was hard. This was heartbreaking for me, having to tell him that he may be sick, he may be getting sick, or that I wasn't going to check his temperature. Because the more that I had reassured him, the worse it became. I remember feeling like a bad parent at the time, when I needed not to answer and provide that reassurance. OCD can start out small, seemingly insignificant symptoms that gradually escalate into more severe and debilitating behaviors. OCD is a bully. OCD does, in fact, feel like a bully because it constantly taunts and torments individuals with intrusive thoughts, urges, and compulsions. It's as if OCD is saying, "You're not good enough. You'll never be safe. If you don't wash your hands over and over again, you're going to get sick. You're a failure. You'll always be anxious." So how can OCD progress? Well, a child might start with small, occasional rituals or worries, such as needing to touch a specific object before leaving the house. Over time, these symptoms can grow in frequency, duration, and intensity. The child might start to feel an overwhelming need to perform the ritual or worry excessively about a particular topic. As the symptoms worsen, the child's anxiety levels can rise, leading to more frequent and intense rituals or avoidance behaviors. Eventually, OCD symptoms can interfere not only with the child's daily life, causing difficulties with school, social relationships, but also family dynamics. But here's the thing, OCD is a treatable condition. With the right tools, support, and mindset, individuals can learn to manage their OCD symptoms and take back control. Remember, your child is not alone. You are not alone as a parent. OCD affects millions, approximately 1 in 40 adults and 1 in 100 children in the United States have OCD. There's hope. With effective treatment, individuals can learn to manage their OCD symptoms and improve their quality of life. As a parent, encourage coping skills. Teach your child problem-solving skills. Encourage them to think critically and develop problem-solving skills to manage their anxiety. Help your child identify and challenge their negative thoughts and assumptions. And support exposure and response prevention, ERP. ERP is a therapy technique that helps individuals confront their fears while resisting the urge to engage in compulsive behaviors. Model healthy communication. Foster an open and supportive environment where your child feels comfortable discussing their thoughts and feelings. Avoid dismissive language. Refrain from using language such as, "Don't worry about it," or "It's not a big deal," because they do worry and it is in fact a big deal. Seek professional help. Work with a therapist who specializes in OCD and anxiety disorders to develop a treatment plan tailored to your child's needs. Involve the whole family in therapy to learn how to support your child's recovery and develop healthy communication patterns. Early intervention is key. Recognizing the early signs of OCD and seeking professional help can significantly impact the child's outcome. Early intervention can reduce symptom severity. By addressing OCD symptoms early, you can prevent them from escalating and reducing their impact on their daily life. Improve coping skills. Teaching children healthy coping mechanisms and strategies can help them manage their anxiety and reduce their reliance on rituals or avoidance behaviors. Enhanced quality of life. Early intervention can improve your child's overall quality of life, enabling them to participate in activities, build relationships, and reach their full potential. Remember, it's essential to approach these conversations with empathy and understanding. By working together with your child and their therapist, you can help them develop the skills they need to manage their OCD symptoms and thrive. Thank you so much for watching, and if you would like more videos on other topics, please feel free to comment below. Thank you for watching. Remember, OCD is treatable, and with the right support and resources, your child can manage their symptoms and be very successful. Don't hesitate to reach out for help, and don't forget to take care of yourself along the way. Make sure to like and subscribe to this channel, and I'll see you at the next video.